Good evening, everyone, and welcome to our webinar tonight. My name is Buffy Squires, and I'm the Community Programs Coordinator here at Musculoskeletal Australia. I'd just like to take a moment to acknowledge the Aboriginal and Torres Strait Islander people as the traditional owners of the land on which our organisation operates and where we come together to work across Australia. We recognise Aboriginal and Torres Strait Islander people's continuing connection to land, the waterways and culture. We pay our respect to elders past, present and emerging, and to all Aboriginal and Torres Strait Islander peoples. If you're new to our MSK Kids program, you might like to take a moment to check out our website. There you'll find school resources, links to past webinar recordings, information on transition, and a section on dealing with pain. You'll also find contact details for our free MSK helpline, where you can contact our nurses. It's a free call. They're available Monday to Friday, 9 to 5, and a really great resource for using between visits with your rheumatologist. If your child is aged between 13 and 20, you may like to check out our online chat group, Teen Talk. Teen Talk is run through Discord, which you have, if you do have teenagers, they're probably on already. It's a great spot for kids to come together and chat with other kids who get it, and really worth checking out. If you've got any queries about it, don't hesitate to get in touch. I'd also encourage you to follow us on our Facebook and Instagram pages. That's where you'll be able to keep up to date on things that are happening, such as webinars, and a nice way to keep up to date on what's going on with MSK Kids. Now, I know some of you may be watching a webinar for the first time, so if you have any problems or issues during the night, please feel free to pop a question in the question box on your control panel. We'll do our best to attend to it. As a backup though, all our webinars are recorded, so you'll be sent this recording sometime in the next week or so. Also, our presenter this evening, Kylie, will be happy to answer your questions at the end of the night. But you don't need to leave your questions to the end. You can actually pop them into the question box at any time throughout this evening. I'd also be grateful at the end of the evening if you could take a moment to respond to our survey. It's only a very short survey, only takes a few minutes, but it helps direct what we will do next year with our webinars. So our presenter for this evening is Cylie Williams. Kylie is an Associate Professor at Monash University. She coordinates the podiatry degree and is a researcher in kids' foot and ankle conditions. Kylie also works in private practice and loves collaborating with families and their health teams to help kids remain active. Kylie's research has focused on finding reasons why some kids walk on their tiptoes, finding effective treatments for conditions that cause ongoing foot pain, and understanding how kids move in different types of footwear. Kylie is currently leading a large funded research project with other health professionals who work with kids with chronic leg pain. This research aims to improve consistency in how we diagnose, talk about and treat many lower limb conditions. This project will also have an education website for families and health professionals. Kylie and her team are looking for families to be part of paid focus groups about this research, and you'll have an opportunity at the end of the webinar tonight to leave your details if you're interested. So without further ado, it's my pleasure to hand proceedings over to Kylie. Thanks so much, Kylie.
Thanks so much, Buffy, and thanks for those who are joining in, and a future thank you to those who are watching this on the recording. And I guess I'd like to start by acknowledging the traditional owners of the land I'm meeting from today, which are the Bunurong people, and I especially pay my respects to any Aboriginal families who are watching today. And we're going to talk about feet, and some people think feet are rather gross. As a podiatrist, I love feet. Feet are not only amazing structures full of interesting bones, but they help kids be social. So when feet are working really well, they help kids to run and jump and play. They help them engage with families, and they help them learn at school. And our feet help us to do so many things for the rest of our lives. All of us know that you only need to step on a piece of Lego and hurt yourself and your feet, and you feel pretty miserable. And so what I would like to cover today is a little bit about some myths about feet that you may have heard during your parenting journey, that you may hear from your health professionals, that you may hear from family about feet, and what how we can unpack some of the myths and some of the facts in all of that. And I'll talk something about children who do have health conditions, and also about children who don't have health conditions but may have foot concerns. So as Buffy said, please place your questions in the chat box as we go along. I'm an active researcher, which means people pay me money to do research. So I always do start with a disclosure slide that at the moment I have a number of government funded research projects all about communication and about children's limb pain. In the past, I've been paid by some footwear companies, so some children's footwear companies, to also help produce good messages about their children's footwear that are factual and not a little bit wacky, because we know that advertising can sometimes be a little interesting. I have no shares in any orthotics footwear companies or any medical equipment. It's really important, though, that I give these disclosures of people who have paid me to do work for them. Now, with this one, what we do before we talk about who's who in the leg zoo, I'm going to quickly ask to pull up a quick poll for those of you who are listening to tell me some of the things, and you can vote for lots, you can vote for none. What are some of the myths that you might have heard about legs? So I believe you can click on some of these and see if we can get some I guess, things that I need to make sure I cover tonight. Now, if people are listening while they're wrangling children and while they're walking around the house doing things, I totally understand if there's not too many responses, because it is always hard to do 3 things at once at this time of night when you have children. Do you want to finish that poll and see, have we got any responses, or are people wandering around their house at the same time? Beautiful. These are some great myths that we've heard. Flat feet are hereditary, so we get them from our families. My child has flat feet, so they need orthoses. Growing pains are caused by growth spurts. Interesting about my child's footwear, and we're going to briefly touch about footwear today because I love talking about shoes, and my child will grow out of their funny walks. So we're going to cover some of these as well as some questions along the way. Let's go to the next slide, back to the who's who in the leg zoo. So one of the things when we're talking about children's feet and legs, there are lots of health professionals who focus. Your GP is often the first person. A paediatrician will often ask you how your child's walking and running. A podiatrist, we really like looking at feet and legs, and we usually may look at legs below the hip, but we do place a lot of focus on below the knee and the foot and ankle. Your physiotherapists, they look at the whole body and they look at how legs work with balance and running and jumping. Some people seek chiropractic support, particularly for hips. When your child has pain, and if they're complaining of foot or leg pain or other joint pain, you may talk to your pharmacist about what medicines could help. Some people seek osteopathic support as well. And there's a lot of the ologists. So it might be your rheumatologist, maybe a psychologist or a pain specialist. There may even be an orthopedic surgeon in that mix as well. And all of these people play a very different role. And the role is really about the lens that we look through. And so if I say something tonight that may be different from one of your other health professionals, it's purely viewed through the lens. So often the paediatrician will be looking at your whole child, whereas your podiatrist may be looking at your whole child but focusing in and zooming in on their feet. Your physio may be looking at how your child moves and zooming in on a different part of their body. And so I really wanted to start this conversation with the lens that we all look through, and that my lens coming to you tonight is around the foot and ankle lens and around how feet work. Because the key to good outcomes comes from this 3-pointed thing, and we'll start talking about the myths in a minute. because as a podiatrist, some of the things, or the first thing I always want to know is what do families want? What's important to them? What do they value? How do they like to spend their time? And then I try and draw on the research, but sometimes research hasn't caught up with what the problem is, and that's where we've got to pull in our clinical expertise. One of the biggest challenges for many people with kids who have chronic pain or kids who have some conditions is that some of those conditions are really commonish, and we have good guidelines and good evidence, and some are rarer. And if you live in an area where you have limited specialists, you may have limited podiatrists and you may have limited physiotherapists, and this means that sometimes it's tricky to get good advice. And so tonight what I'm going to try and do is give you some tools as well to be able to ask the right questions and to be able to really voice what you value and what your preferences are in care as well. So let's deal with this first myth. I had orthoses for flat feet when I was a child, and now I've got an arch, so my child will need them as well. Or my child has flat feet, so they need orthoses. And as a podiatrist, and I'm a pretty old podiatrist now, I have heard this one for a long time throughout my career. And I only Googled for 5 minutes and I found all of these pictures that you've probably seen many, many times, where we see flat feet are bad and arch feet are good, or rolling in feet are bad and straight feet are good. And one of the biggest challenges is, as we learn more and more about feet, we learn that they change over time. And so some of those lines that they're saying are really bad can actually be something that's really normal for a young child. And that as a child grows, their bone shape changes and their muscles change. And so where we're saying these things are bad, we don't really know that, because what we do know is over time, foot and leg shape changes. So I'm going to give you just a little quick example of this, and we go to the next slide. And this is a picture of someone's foot. Now this person is a runner. And I'm going to give you a poll, because we're going to talk a little bit about orthoses, and orthoses being something that you put inside a shoe to try and make a foot look like it's got a better position. Should this person wear orthoses? So yes, they should, no, they shouldn't, or you're not really sure. And when you've clicked on the button, hopefully we should be able to go back to what we think about this person's foot. How did we go? We've got an even spread. That's a really nice way to explore that. No, they shouldn't. Yes, they should, or we're really, really not sure. And to be really honest, the unsure is probably the best answer here, because what we don't know is who this person is. Now, some of you might actually know who that person is, and that's Capochi, one of the best long distance runners in the world, who is gone on record for, he's got no foot problems. He runs huge long distances and hold world records, and has done for some time. And this is a snapshot in time of what his foot position looked like while he was on a long distance run, and a long distance run where his feet were actually fine. So then what does it mean to need orthoses? Before we can actually say that someone needs orthoses, or these little pieces of plastic that go inside shoes, we really need to explore what orthoses do. You may have heard in the past, you may have heard quite recently, that orthoses are like braces. You put them on and they straighten things up. but they're not. They're actually more like glasses if we're going to put them to something that you already know about. So they work when you're wearing them, and when you take them off, they don't work anymore, similar to glasses. They don't create a straightening effect, and that's something that we used to think. And when I say used to, I actually trained in the 90s, and I was taught that children with flat feet needed orthoses. We put them in and it gave them an arch as they grew. And there's been some really big trials that have actually explored this, where they did nothing and they used orthoses with children, and that basically after a couple of years, both kids had a fairly similar looking feet. So that's really about appearance. And what we really need to think then is about, well, function. What do they actually do? We know through research that orthoses reduce pain. And they reduce pain by changing how muscles work. So they can make some muscles work more effectively, and they can make some muscles not really work at all. And so muscles that are tired, they can actually reduce the tiredness or the fatigue in those muscles. Through putting the foot and leg in a more effective position, they can also help kids improve their gross motor skills where there is a foot problem. So not for all kids, but for kids who are really struggling to hold their balance, they can really help there. And they do that through distributing forces or pressure. And I'll talk about that a little bit on the next slide. What we know orthoses don't do is that they don't change the shape of feet. So they don't give a child an arch. If they're going to get it, they're going to get one anyway. We do know that they can be really annoying in shoes, that they don't always fit, you got to change them between others, and that they don't always change the way that skin looks or feels. And for some kids, especially kids who have connective tissue disorders, they can get little bubbles on their skin, and an orthotic won't change that at all. They're still potentially going to get those. One of the other things they can do is they can actually create some hardness of skin because they are putting force through the foot in a certain way. Now, this can be a good thing or a bad thing. Often it's just a thing and the kids aren't overly worried about it. But we need to balance out what we do with orthoses and be really clear on what the good outcome is going to be. And so the take home for orthotics is really they can work for some kids, and they can work for some kids if they have a condition that makes their muscles work hard. And because they change force, and a really good example of force is if you are if you've got some seedlings out in the garden and you want to water them, you don't put your hose on stream and stream it through. You'll wash all the dirt away. Instead, you put your hose on spray and it distributes the water so you don't wash all your dirt away. That's kind of like how an orthotic works, is it distributes the force over the full foot. And so for some kids with conditions like juvenile idiopathic arthritis, if they have symptomatic joints in their foot or ankle, then an orthotic can actually distribute the force over the whole foot rather than just that symptomatic joint, which may be more painful. Some kids who have conditions, clotting disorders like haemophilia, we're finding more and more that orthoses can also redistribute the force, so pulling it across the whole foot rather than just those little joints, to help reduce joint destruction in the future. Now, what that actually means is it mightn't take away the pain for some kids, but what we think it does in the long term, and this is quite new research that has come out, is that where kids have juvenile idiopathic arthritis or where they may have connective tissue disorders, and we redistribute the force, that it can have fatigue and functional effects. And function means things like running and jumping, walking longer distances, but the kids still might get some pain. And so we need to measure these outcomes very, very carefully. Orthoses can also work if feet are working really hard and kids can't keep up with the other kids at school. So again, they might still get sore feet, but they might be able to play for longer. Orthoses sometimes work if kids have injuries, and the orthoses change the muscles work, and it gives some muscles a rest, and maybe even some soft tissue a rest. So some kids with lumps in their bones, some kids who get heel pain as they're growing, orthoses can help change how the force goes through those sore joints. And the type of orthotic is what some families ask about, like, do I need a custom orthotic, or can I get something from the pharmacy? It really depends on how much force is needed. And a lot of times you can almost give it a go with getting something from the pharmacy or a sports store, because a lot of kids don't need much force because they're quite lightweight. But when they get a bit bigger, they sometimes need the harder style orthotic that say a podiatrist or a physiotherapist may be able to give you. So things from here to ask your health professional, if they're suggesting that orthotics or orthoses might be important for your child, is to ask them, well, what does success look like? Because one of the things we're learning more and more is, it's especially with kids with inflammatory disorders, they may not actually change pain. They may change fatigue. So we need to be able to measure that. They may change being able to keep up with other kids. So we need to be able to measure that. They may even change velocity or speed. Now, not many of us want our kids to get faster, but sometimes it's important for some kids to get faster because it helps keep up with their friends. The other alternative, and especially if you have limited access to some health professionals, is what shoes can help, because more and more we're finding out that shoes and some features on shoes, and I'm going to talk about shoes in a little bit, can actually do almost the same job as an orthotic. And so what we know is, or what we can bust with this one, is that if families needed orthotics or parents needed orthotics as a child, we don't know if their child will need it. They might, they might not. And if children do have flat feet, they mightn't need orthotics. They might, but they probably won't, because flat feet can actually be quite healthy. The next myth we wanted to talk about tonight was about growing pains, and growing pains being related to my child having a growth spurt. Now, what we don't know is actually why some kids get growing pains. Now, they're generally in legs and feet. It is very, very rare that children will have growing pains in their torsos, so their tummies and their chest, and even rarer will they get them in arms. But we know that torsos and arms continue to grow, so why don't we get growing pains there? Growing pains tend to happen in the afternoon and in the evening, and often at night when kids will wake up and cry, saying their knees or their ankles or even their feet are sore. But true growing pains are gone the next day, and they don't impact the kids during the day. And so if these are actually occurring, it's very unlikely that they're growing. But kids grow during the day and at night. Growing pains can occur every few weeks, every few months. And one thing that I haven't written there is growing pains actually do tend to run in families. What we do know about growing pains, though, is they are very much linked with muscle fatigue. So what we can actually track is that they're linked often to a particular day activity. They're very common in both legs, and they can be especially worse when the child's actually having a really miserable day as well. If things haven't gone well, we know that for some reason they will get more likely to get growing pains that night. Growing pains also may be linked with other health conditions, so it is important, if children are getting pain at night or in the afternoon, that you do speak to your GP or your rheumatologist if you do have one, or your other health professionals, because a global assessment is always encouraged. We do know with growing pains that they're actually not to do with growing. They're more to do with that kids have had a really big day. We know that cuddles help, heat help, some simple medicines to talk to your pharmacist, like paracetamol or even ibuprofen type medicines if your child can take those. And even some type of exercises before bed can actually help. For kids who their feet are in a certain position that are making their muscles really tired, orthotics can help, and even sometimes changing different types of shoes. So really, growing pains aren't really to do with growing. They just kind of happen in kids who are growing, but instead they're really to do with how legs are actually working during the day. Now, the last one, the next one was around kids' footwear, and I'll only briefly talk about these ones because people didn't really have an opinion on shoes, and this is something I get asked a lot about. So it may just be people online haven't heard these. We hear rumours and we see advertising that kids need to be in really soft shoes, or kids need to be in really hard, strong shoes to help their feet develop. And I've got 4 little points on the slides that I'll just read out. And these are taken directly off shoe marketing websites yesterday. And this is one shoe marketing website: free toe movement improves cognitive and motor development. So the way these shoes work is they help your child's brain and motor development. Another shoe marketing says ensuring the right mix of adjustability, flexibility, breathability, and fit help them grow and naturally develop. Another website says trainers may be very comfortable and lightweight, but they encourage the feet to spread over time and become flaccid, which is the most awful description I've ever heard of feet. And another one says footwear helps to protect their feet from injury and from heat and the cold. And so as families, one of the things when you're going to hear about shoes, you may encounter all of these really mixed messages. And what we do know about shoes is they are different all around the world, and there is no difference between foot problems all around the world. Australia, our kids often wear flip-flops or thongs or slides. They may go bare feet in some parts of the country. In other parts, particularly recently, they're in gumboots a lot because there's a lot of water, right through to soft-soled type of shoes or snow boots. What we do know about footwear is a little bit of everything is okay, and that when a child does have foot problems, to tailor the shoe to them. And the only generic advice for shoes is really they do protect your feet from cold and from wet and from hot. And as long as they fit right and they don't hinder the child from doing everything they want to do, then it's probably the right shoe for them. And so really moving forward with how you're purchasing, kids really can have a bigger say than we probably let them sometimes. Some of our recent research has supported, parents told us how they wanted us to talk about shoes, and this is something we're spreading the word with health professionals to give particular names to shoes so that you understand how we describe shoes where we're recommending some for some people. So some kids need shoes where it doesn't matter if they're really, really sloppy and bendy. And some kids need shoes that are rigid, stiff or hard because it kind of does a job instead of an orthotic. Whereas other kids need a fastener or something that holds the shoe onto the foot, whereas other kids are actually fine without that. Because what we do know about kids' footwear is that kids' preference look, and so that's really tricky for parents because you walk into the shop and they'll pick up the ones that potentially look like pink dinosaurs or unicorns, and that's the only one that they want. And it's probably okay for particular tasks. There are some features of shoes that improve their function. So it's sometimes hard to climb a tree when you're wearing thongs. So either do it in bare feet or pop some runners on. It's hard to walk on tan bark when you've got bare feet, or if you're in ballet flats, because things kind of get in them. So probably pop some runners or a boot on. It's hard to walk in sand if you're wearing boots because it's hot and yucky and sand gets inside. So you could probably go in sandals. There are a few features in shoes that actually create long-term issues. So I think you can quite confidently, if your child has minimal foot problems, they probably can wear what they preference or what they like. Because what we do know for some kids, flexible shoes is really important for them. But what we do know for other kids, particularly those who have to wear orthoses, or particular bigger orthoses that go up the back of their legs like AFOs, then a harder type shoe actually will help those things work better. So we're on the home stretch, and the last one is around kids will grow out of the funny ways that they walk. And this is a really tricky one because some kids walk turned in, so with pigeon-toed, and some kids walk turned out, or kind of like a penguin. And some kids walk up on their tiptoes. And so throughout the journey, when we see kids walking differently, we are concerned that they'll walk like that forever. Now, in-toe walking is probably one of the most common things that parents are concerned about, and is the most common thing that kids grow out of. But for most things, there are a couple of quite serious conditions, that means all kids who in-toe walk should be either seen by your GP or by the maternal and child health nurse, and they're younger. And you can monitor this over time through looking at videos to watch your child growing. In-toe walking can come from hips, so turned in hips, can come from knees, it can come from the shin bones, or it can come from the foot bones. And that means it's tricky sometimes to know if the kids are going to grow out of it or not. If they are, they will commonly grow out of these with no issues before they're school aged. And so for the most common reasons kids in-toe walk or walk pigeon-toed is a little twist on the shin bone. It's a really common thing that young children have. It's by the way that they develop when they're in utero or in mum's tummy, and that bone has a little bit of a twist and it turns with time. It is the thing that can make children look like they trip a lot, and sometimes the best thing to not trip is to learn how to not trip by tripping a little bit. But if the kids are tripping so much that they're hurting themselves and they are tripping still at school age, this is a really important time to talk to GP and also to potentially orthopedic surgeon. There's no orthotics that can help with in-toe walking. There's no special twister anything. We just need to make sure that there's no underlying health conditions. That's one of the most important messages with in-toe walking. If in-toe walking is coming from the foot, or the foot looks like it's a little banana, that's best treated as early as you can. So it's one that we do want to see nice and early. Out-toe walking, or walking like a little penguin, is less common, and the kids are actually less likely to grow out of it. And it is something, it can be for a multitude of reasons that we could probably spend a whole hour talking just on out-toe walking. But it's best to say, if you are seeing that and your child is walking out like a penguin, that it's best that they do get assessed, either by your GP, local podiatrist or physiotherapist, to find out what the reason why is. Often kids who do walk out toe can end up with some muscle fatigue, both in their foot and their leg. Toe walking is something that I see a lot of. It can run in families, or it can be a result of some very simple conditions or some very serious conditions. And generally, the advice with toe walking, if kids are walking from pain, they need to see someone for us to unpack what is hurting and why. And then the treatment depends on what's causing that pain. If young children are toe walking, so under the age of 3, a lot of these kids will actually stop. but there's a small percentage who won't, and we need to carefully tease out if there's actually a medical reason for some of those kids. And one of the key things is when it does run in families, finding out how the parents actually resolve that toe walking in time. It can be quite common. There's a condition called idiopathic toe walking. It's can be 1 in up to 20 children, so it is quite common, but it rarely does cause problems. But we need to be sure that it is a less common condition, a less serious condition, and not so much of one of the serious ones that are around. So if there is toe walking, it is one that we always say to get checked out. So the tips, this one is a partially busted myth. Childhood walking or position type concerns, it's more about if the child has pain, so if things are hurting, if there's any fatigue, if they're not keeping up with other kids their own age, if there's particular joints that are red, hot or swollen, particularly in toes or the ankle, the back of the heel or the side of the arch. Sometimes you might be talking to your pharmacist, and your pharmacist's encouraged to take something, but to take a picture so that your health professional can see. Because when we know the reason and we start treatment on that reason, we may also want to protect that joint in time, and that might be with prescribing shoes or prescribing orthotics. If your child's tripping more than their friends, it's something we health professionals always want to hear about. And if there's any funny rashes, bumps or spots. One of the others that is a little bit more of an emergency type situation is if they're not putting weight on their leg or their foot. If that is known to be linked with a condition, then calling your GP or your rheumatologist if you have one. But if it's a new thing, it's probably best that you seek care a little bit earlier for that. And that kind of goes hand in hand with limping. The other thing that health professionals are always concerned about, and I would encourage if you haven't spoken up, is where these health conditions or their walking issues are impacting their mental health, where they don't want to play with their friends, where they're worried about how their legs look. Sometimes we can be quite we might say, don't worry, they'll be fine. But if it is something that we know that the kids are actually really worrying about, then as a health professional, we need to know that as much as possible. So this one's a partially busted myth, because a lot of things kids actually do grow out of, but there are some things that they don't grow out of that we probably need to keep an eye on and help you to look after things at home. So coming into the last little bit about, well, if you're in a location in Australia that you can't always seek advice, that it's hard to get into a GP or it's hard to get into your specialist, that you can only see generalist physios or podiatrists who may not be keeping up, mainly because they mightn't see many of these things. We're aware that the distribution of specialists around the country is different depending on where you live. So what I've provided on the screen now is actually some really up-to-date websites. Sometimes it can help you to take them along to your health professional if they're not sure, so you can both learn about things together. The Better Health channel is one that a lot of health associations, I know my team regularly updates when new evidence comes out on the Better Health channel and raising children. The Conversation has some up-to-date areas that health professionals have written about flat feet and toe walking and growing pains and legs that are walking in different directions. And a lot of the children's hospital websites also provide really up-to-date parent advice that you can on when to go to ED or when to go to your GP, when to seek help, or when you might be able to do something at home to support that. The last slide is just a little bit about the project that we've been funded by the Australian government to do, and that's to try and improve consistency and to provide some up-to-date education on some of the less known conditions. we are seeking parents to be part of that. If you are interested in being part of any of that journey through being on some focus groups, the Scan Me QR code on the site, you can go to and leave your details, or you can head on to Instagram or Twitter, and we've got things there. But I'm going to pause there. That's the end of all the formal part. If there is any questions, I'm more than happy to answer anything that people might have.
Hi, Kylie. I'm going to just pop back in here briefly and say thank you for that. That was a very interesting, informative presentation. I don't know that I'll get the image and the words flaccid feet out of my mind for a while. I don't think that needed to be there.
It's the most horrible thing I've ever heard.
So we've got a few questions come through, so let's get started. If anybody has more questions, please don't hesitate to type in the box, which you should be able to see on your control panel. Okay, roughly what age are feet fully formed?
Oh, that's a fantastic question. So when babies are born, they probably have about 30% of their foot is bone, and the rest is actually cartilage or really soft bone, kind of like your nose and your ears. By the age of about 6, you've got all your bones there, but all of them have growth plates. And those that don't have growth plates have they've still got a bit of growing to do. You just wouldn't see it on X-ray. When kids hit puberty, just a little bit before and a little bit after, things called secondary growth plates pop up. And this can be around the time where some kids get things like calcaneal apophysitis, also known as Sever's disease. It's not a disease. You can't catch it. It's an awful term. It's a sore growth plate. It's the same, some kids get it in their knees. It's also known as Osgood Schlatters. It's a growth plate itis, or it's a growth plate that's sore. Those growth plates open during puberty to help for rapid growth, and then everything closes around 17 to 19. So feet grow, particularly for boys, up until around 17, 18. For girls, a little bit younger. All the bones are there by 6, but they've still got lots of growing to do in between those teenage years as well. So we say growth comes with growth plates. So when they're there, the feet are still growing. So really, feet are fully formed when you're kind of an adult. Okay.
And another question's come through about the different prices of school shoes. Is there a difference between your sort of $120, $140 school shoes and the $20 ones that we can pick up at Kmart?
Oh, that's a fantastic myth. No, there's not that much difference. What you're actually paying for is the quality of the leather and the design or the thinking that has gone into them. So for some kids with healthy feet, now I've got 2 boys, and I'll often use this as the example of how I approach school shoes. I have one child who has pretty dodgy feet. He used to get really, really sore feet. He'd lose his orthotics. He'd do all sorts of random things. I used to buy expensive shoes for him simply because I knew that even when he lost his orthotics, they had a hard heel counter and what's called a firm midsole. So the middle was actually quite firm. And so he used to have less foot pain in those. My other kid has no foot problems at all. He used to get $20 Target, Kmart. He was also a wrecker, and he would lose them all the time. So I didn't care if I had to buy a couple of them throughout the year. He and both of them now have adult feet, and they're both fine. So it's really about buying what you can for your budget. And if your children have feet that are actually okay, then what fits your child, so the shape and the length, is far more important than the price tag that goes along with them.
Yeah, makes sense. Okay, one more has just come through. My teenage daughter insists on wearing high heels. Is there going to be long-term issues, damage?
I won't let you see what I'm wearing today. Look, I think high heels are a little bit like chocolate. If that's all you're going to eat, you're probably not going to be healthy. But like everything, no one wears high heels for 20 hours a day. If your daughter wants to keep up with her friends, she'll probably chuck her high heels off and she'll walk. So balancing is really important. If she's going to go out with her friends and want to wear them, tell her to pack a pair of thongs in a little carry-on or a little pair of ballet flats so she's not walking home on hard surfaces with no shoes, because that can hurt. And just pick the shoes for what you're doing. Yeah, I'm probably not the best podiatrist to answer that question, because I'll always go,
you like shoes.
I do like shoes. High heels won't hurt if you're not wearing them all the time.
Too much. Yeah, makes sense. Okay, and this looks like the final question at this stage, unless anybody wants to type something through. My teenage son has JIA and pain in his metatarsals in his feet. Any shoes suggestions for him?
Yeah, absolutely. Depending on his foot shape, so shoes with additional cushioning, particularly shoes with cushioning in the front of the foot, is really important. I should have had some shoes with me, but shoes that have a little bit of a rocker also help. So that rocker motion allows the shoe to rock and reduces how much those joints have to work when they're a little bit swollen. If there's inflammation going through any of the soft tissues, it can also.
Shoes, that brand Skechers, do they have that slightly curved?
No, yeah, Skechers don't as much. They used to have this rocker one, but they kind of went off the market because a few people fell over in them. And Skechers have quite a cushiony shoe, but the cushion wears out quite quickly. So this is, again, buy to your budget.
Yep.
If you can afford a really cushiony shoe that you have to replace a little bit more, for kids, then something like Skechers, Asics are another brand that tends to have quite good cushioning. And as the kids get a little bit bigger, there's some shoes like the Hokia. They do look a little bit like boats, but they are like walking on a cloud.
Right.
If you find that your child isn't liking, or your young person isn't liking the look of those shoes, we can replicate that cushioning through an orthotic device. So this is kind of where you go, what would they prefer if they kind of like some of these. Another brand that has them, the Fresh Foams in New Balance, have an extra cushioning, and some of the Nikes have them as well. You've just kind of got to go what feels the softest and squishiest in that area, and what has the front of the foot, the front of the shoe, what rocker it has.
Yeah.
So if you think of things like Nike Air Force Ones, they're flat as a tack. They're probably not the best one.
Okay. Yeah, makes sense. Kylie, I'm hoping you can still hear me because you've frozen on my
end. Who have sore toes and sore metatarsal joints to be in, they'll put a lot of pressure.
Yeah.
Oh, I'm back.
Yeah, you're back.
where did I get to about the
Nike not being so great?
Yeah, just avoiding shoes like Nike Air Force One. Yep. Yeah, Nike, the Air Force Ones, the Globes, the Jordans, the ones all the kids love, they're super, super flat, and they just put a lot of force through those joints. So it's probably best, if you can, to avoid those ones.
Yeah, great. Okay, one final question I think we've got here. My son has very wide feet, so he's always having to wear shoes too large for him. Is that a problem with walking, given that the toes are always a bit too long?
It's not a huge problem. It can mean that kids sometimes trip. Instead, you could look for some of the wider shoes like New Balance. New Balance have quite a wide shoe. There is also, so they come in 2 widths. So New Balance has an extra wide. There are some other shoes. They're brand called Friendly and a brand called Billy's. They both have extra wide as well. in kids' sizes, and they can be purchased on the Every Human website. So just depending on how wide the child's foot is, it is often better that you only have kind of 1 centimetre to 1.5 centimetres than the longest toe. So if that's the big toe or the second toe, anything more can kind of make the kids be a little bit trippy.
Yeah, makes sense. Okay, well, that's handy to have those couple of brands for people with kids with wider feet. So that brings us to the end of our questions. Thank you so much for a fantastic presentation tonight. Just a reminder to our attendees, the webinar is recorded and will be available and sent to you and also up on our website before too long. Thank you again for attending, and just a reminder, if you could please fill out the very short survey that will pop up on your screen in a few minutes. And wishing you all a good night, and thanks again, Kylie.
Thank you.
Bye.
Bye.